degrees. The reason you do want them bent and not fully extended is because you want to be able to palpate the joint line, and that'll also make it easier to palpate MCL and LCL. So again, this position or supine with the knees bent is fine, but either position you do need to have the knee bent. So the first one we have is patella. So patella is really easy. It's right there in the middle of the knee. But what we do want you to let us know is that the quadriceps come over it, and then it turns into the tendon that attaches on the inferior. For the patella. Wait, hold on. For the patella, is the inferior aspect the base or the apex?
Apex.
Remember, it's flipped down. So the superior portion of the patella is your base. The inferior portion of your patella is the apex. So remember that it's flipped upside down. So we do want you to appreciate the whole borders. So palpating superiorly, finding that the base, then palpating inferiorly. That pole is a little bit harder to palpate because there's patellar tendon that does attach to
The tibial tuberosity.
the tibial tuberosity, which we'll get to in a second. But because that is such a thick ligament, palpating that whole rounded apex can be a little more difficult. And then palpating medial and lateral borders, you should be able to do some medial lateral mobs, very gentle, just feeling it. And then you can even see if you can get the patella to tilt a little if you press on either lateral edge.
Generally, those things will be much easier to do with an extended knee,
Yes.
slightly bent.
Yes.
So you'll learn all of that stuff
Yes.
more specifically in MS1 next term.
Yes. You'll learn patellar mobs later, and exactly like Dr. Parker was saying, that's easier with the extended, but for the rest of this, we're gonna do knee bend. So then after you find the patella, you're gonna come immediately off of the lateral, both medial and lateral borders of the patella, and the bony prominence that you're poking on the distal end of the femur, your femoral condyles. We'll get to the epicondyles in a second. But we're knowing that as soon as you come off on the medial and lateral sides, you can palpate superiorly, inferiorly. You'll feel the rounded bony femoral condyles. Everyone following me so far?
Yes.
Femoral condyles. So again, another reason, you kind of want to have them in like a 90-90 because it just helps. It helps.
I didn't even notice I was doing that.
It helps with palpating. So once you've found the femoral, medial, and lateral condyles, if you continue to move posteriorly, or if your leg was straight, it would be a superior. But here you can kind of see how I'm just coming posteriorly off those medial and lateral condyles. I'm going to palpate the medial and lateral femoral epicondyles. Is everyone understanding that? We'll throw up a picture later of the osteotomy, but just for now. What is everyone? What?
They're like feeling. They're palpitating.
Oh, I was like, so we're good. Patella.
Let's do this. Let's turn this table to a very slight angle.
Yeah. I mean, I totally could do it, but for your safety.
Right.
Do you want me to lift the table with her?
Good coverage.
I mean,
All
cause of back injuries.
Good mechanics.
Body mechanics. Yeah. Very
More back than leg.
I don't know which way this way should not walk. I think this is halfway.
You just sit wherever you want to sit, and I'll adjust.
So okay, so we have patella, condyles, epicondyles. Are all good? Start again going back to these condyles. If you come just inferiorly, you're going to start feeling some squishy space, but this is why you want the knee bent to open up that squishy space. The official term, I guess, is like tibial femoral joint line, but squishy space.
I like that.
Palpate the squishy space.
Please write that on the exam.
So you want to follow that medially, and we'll get to the collateral ligaments here in a second, but palpating that, following that along medially. And it's not a lot, it's like maybe half a finger width to a finger width of space depending on patient size, and then laterally. So you just want to have an appreciation for that joint space. You'll be able to palpate a very definitive gap between femur, tibia, fibula a little bit further back. Good? Okay, so now we found tibial femoral joint line.